Remote case management nursing sounds simple from the outside. No bedside shifts, no commute, no running from room to room. But remote does not mean easy. It means the work changes, and nurses need to understand what that change actually looks like before applying. Because remote case management is still nursing. It still uses clinical judgment, communication, patient education, documentation, and problem solving. But instead of walking into a patient's room, you may be reaching them by phone, video, secure messaging, or through a care management platform. And that changes the way you assess, communicate, organize your day, and build trust. A remote case manager may work for an insurance company, a hospital system, a population health program, a clinic, a disease management program, a workers' compensation company, or a care coordination team. Some roles focus on patients after discharge. Some focus on chronic conditions. Some focus on high-risk members, utilization review, prior authorization, behavioral health, maternal health, or long-term care coordination. So, remote case management is not one single job. The word remote tells you where the work happens. It does not tell you what the work actually is. That is why the job description matters so much. A remote role that focuses on telephonic case management may involve calling patients, completing assessments, creating care plans, identifying barriers, educating patients, and following up over time. A remote utilization review role may involve reviewing charts, applying criteria, looking at medical necessity, authorizations, continued stays, or level of care. A remote transition of care role may involve contacting patients after discharge, reviewing medications, checking follow-up appointments, confirming equipment or services, and helping prevent avoidable readmissions. All of those can be remote, but they are not the same day-to-day experience. One of the biggest adjustments for bedside nurses is that remote case management relies heavily on communication without being physically present. At the bedside, you can see the patient. You can notice their breathing, their movement, their facial expression, their environment, and how they respond when you walk into the room. Remotely, you often have to listen differently. You are paying attention to tone of voice, hesitation, confusion, frustration, and what the patient is not saying. A patient may say, "I am fine," but then mention they have not picked up their medication. Or they may say they understand the discharge instructions, but they cannot explain what follow-up appointment they need. That is where nursing judgment still matters. You are not doing a hands-on assessment, but you are still assessing. You are asking better questions, listening carefully, and identifying gaps that could affect the patient's safety or progress. Remote case management also requires strong organization. In many roles, your day may include scheduled calls, unscheduled calls, documentation, care plan updates, provider communication, team meetings, task queues, referrals, and follow-up reminders. There may not be call lights, but there are still competing priorities. You may need to decide which patient needs a follow-up today, which issue can wait, which barrier needs escalation, and which documentation has to be completed before the end of the day. That is a different kind of pressure. Remote work can feel quieter than the hospital, but it can also feel very task-heavy if you are not prepared for the structure. You may have productivity expectations. You may have call goals. You may have required documentation fields. You may have specific workflows that must be followed. For some nurses, that structure feels helpful. For others, it can feel repetitive or isolating, especially if they are used to the movement and teamwork of a clinical unit. That is why it is important to know your work style. Remote case management can be a good fit for nurses who are self-directed, comfortable using technology, able to stay focused without constant supervision, and good at communicating clearly by phone or in writing. It may also fit nurses who enjoy education, follow-up, care coordination, and helping patients understand what to do next. But it may not be the best fit for someone who wants a role with very little documentation, very little phone work, or very little computer time. because most remote case management roles involve a lot of screen time. You may be documenting assessments, updating care plans, reviewing records, sending messages, tracking tasks, and navigating several systems at once. That does not mean the role is bad. It means nurses should understand the trade-off. You may gain flexibility, avoid a commute, and reduce the physical demands of bedside nursing. But you may also spend much more time sitting, typing, talking on the phone, and managing your own workflow. Another important thing to understand is patient engagement. When you are remote, not every patient answers the phone. Not every patient wants help. Not every patient is ready to talk about their medications, appointments, symptoms, or barriers. That can be frustrating. You may know the outreach matters, but the patient may not see the value yet. So part of the role is learning how to build trust quickly. You may need to explain who you are, why you are calling, how you can help, and what the patient can expect from the conversation. This is where bedside nursing experience can help. If you have ever educated a patient who was overwhelmed, helped a family understand a care plan, or noticed that someone was confused but afraid to say so, you already have communication skills that transfer. The difference is that in remote case management, your voice and your questions become even more important. You have to create clarity without being in the room. Before applying for a remote case management role, there are a few things nurses should look for. First, find out whether the role is case management, utilization review, prior authorization, transitions of care, disease management, or a blended position. Second, look at how much patient contact is involved. Some roles are mostly phone-based. Others are mostly chart review. Some include both. Third, ask about productivity expectations. You want to understand whether success is measured by calls completed, cases managed, care plans updated, reviews completed, documentation timeliness, or quality outcomes. Fourth, ask about training and support. Remote work can feel isolating if you are learning a new specialty, new software, and new workflows without enough guidance. And fifth, ask about the schedule. Remote does not always mean flexible. Some roles have set hours, monitored availability, scheduled breaks, weekend rotation, or required coverage times. That is important to know before accepting the position. It is also worth preparing your homework environment. You may need a quiet space, reliable internet, good organization, and the ability to protect patient privacy while working from home. That part is easy to overlook, but it matters. Remote work can blur the line between home and work if you do not set boundaries. When your workspace is also your living space, it helps to have a clear start and stop routine. Otherwise, it can feel like the work is always sitting right there. The biggest takeaway is this: remote case management can be a meaningful path beyond the bedside, but it is not simply an easier version of nursing. It is a different way of practicing nursing, one that depends on communication, documentation, organization, technology, and the ability to assess patient needs without being physically present. For the right nurse, that can be a strong fit, especially if you enjoy education, follow-up, care coordination, problem-solving, and helping patients navigate the healthcare system from a distance. But before you apply, slow down and read the role carefully. Remote tells you where the work happens. The job description tells you what the work actually is. And understanding that difference can help you choose a role that fits your strengths, your work style, and the type of nursing career you want to build next. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there.